The World Health Organization, that's the WHO, has declared Nigeria free of the wild polio virus following the completion and acceptance of documentation for the free status by the Africa Regional Certification Commission for Polio Eradication. The UN Health Agency disclosed this on the official Twitter account of its regional office for Africa in Brazzaville, Congo. Dr. Faisal Shuaib, Executive Director and CEO of the National Primary Health Care Development Agency, in a tweet, described it as a historic day for Nigeria, Africa and the global polio program. This implies that there are no local circulation of the wild polio virus in Nigeria. But experts are saying that this is not the time for Nigeria to rest on its oars, as it must continue to work to ensure to sustain the gains. Well, joining me via Skype to discuss this is Dr. Tunji Funcho, physician, cardiologist and chairman, National Polio Plus Committee of Rotary International. Good morning and thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
Apparently, it shows that with this declaration by the WHO, efforts by your organization and also all other well-meaning Nigerians and the federal government has yielded positive result. But talk to us, how much of this, how important is this information to Nigerians? And because there are also controversies with regards to this declaration as well.
Well, I think let us bask in the glory of having reached this very important milestone, not purely for the declaration, but for the fact that in the last almost 4 years now, not a single child in Nigeria has been paralyzed by the polio virus, thanks to the effort of Rotary International and Rotarians and the global polio education partners, which essentially involves the government of the country. So there's no controversy about that. The documentation procedure was a very exhaustive procedure. The Nigerian Certification Committee went to every nook and cranny of this country, ensuring that what is required to ensure, number one, that there's no wild polio virus lurking anywhere in the country was established. It was also established that the surveillance system that will pick any polio up in any part of the country where it may occur is also very robust. And with that, we are assured, that polio is gone wild polio virus is gone for Nigeria for good, except it is reimported. And so I celebrate with everybody concerned with this marathon effort. It's a momentous time. However, as long as there's polio in any part of the world, then the children in Nigeria are not safe from reimportation. And that is why we need to keep the effort on to ensure that immunization continues, that children still get routine immunization. In other words, they take their kids to go and get the normal scheduling of routine immunization at their primary healthcare centers. And of course, when COVID-19 permits us, we're going to start doing the house-to-house immunization as we have been scheduling in the past. So it is not yet Uhuru, but at least, let us bask in this glory of having reached a very, very historical and heartwarming milestone.
Is that the only concern you have concerning this declaration?
Well, the only concern we will have as far as this declaration is concerned is for people to rest on their oars, to believe that it's all gone and stop doing what brought us here. We will continue advocating for routine immunization with government, with traditional leadership, religious leadership, and community-based influencers. We'll continue to create awareness in our communities. We'll continue to require funding. And this is where it is very crucial. As we get to the end of this polio eradication efforts, in other words, get to world polio certification, the government itself should rise to the occasion and continue to increase not only the health budget, but the budget specifically set aside for polio eradication. I think that is very important. And of course, on the parts of partners and government, we need to ensure that when the need arises, we still go house to house to mop up those children we may have missed who have not had access to routine immunization.
As much as it is important that we do not rest on our oars, like you rightly mentioned, the issue of COVID-19 seems to be posing a challenge here because a lot of persons are afraid to take their children or wards to the hospitals, and some hospitals are not even allowing people coming for one examination or the other. That is one. And as on the aspect of funding, the government seems to have a whole lot on its, seeking its attention at this point. So how much of a challenge does this pose in the mix of trying to ensure that we do not rest on our oars as much as we have achieved this stride?
I believe that, even for the polio program, we have shifted our focus a bit, leveraging our resources that we've been using in polio eradication for containing the COVID-19. A lot of volunteers and staff actually are spending almost 70% of their time working to ensure that we keep, a lead on the polio pandemic. So it is just a pause. We are very lucky in Nigeria that, COVID-19 came at a time where there's no more polio transmission in Nigeria. Perhaps we'll have been having more difficulties. So right now, we would support all available resources, being put to use for the purpose of containing the pandemic, such that as soon as the pandemic is over, we will resume our efforts to sustain the gains we've made in terms of polio eradication and ensure that, funding continues to be provided. But right now, we have shifted a lot of our resources to assist in ensuring that, the pandemic of COVID-19 is over in Nigeria.
But WHO is saying that perhaps, and even scientists are also saying that perhaps COVID-19 might be with us for the next 18 to 24 months. Would we be able to wait that long before we continue this fight?
No, not at all. I think it is important. You mentioned routine immunization. I think it's important for awareness to continue to be created for mothers to continue taking advantage of the facilities of primary healthcare centers. I'm aware, at least in Lagos State, that primary health care centers are open. They're doing immunization, they're doing antenatal care, and all that is required is for them to have assurance that they are safe to go there. I'm quite confident that arrangements, have been made at primary healthcare centers to ensure that, no child, no mother is exposed to COVID-19, because all the essential requirements of hand washing, hand sanitizing, safe distancing, wearing masks do take place at these primary healthcare centers. And I hope a similar thing is occurring at primary healthcare centers across the country. So there's a need for creation of public awareness that these services continue. We're not talking about big hospitals. We're talking about basic primary healthcare centers where this routine immunization have been taking place all along for decades, literally.
Now, before we build on how we should move from here now, quickly help us better understand how Nigeria got to this point of being able to totally eradicate polio from the country, because Nigeria was the last country on the continent that eradicated polio virus from the country. Talk to us about the struggle.
I think, this milestone of being a polio-free country, it's a testimony to what people coming together with one, purpose, with one vision, and willing to put all the resources available to them to ensure that that purpose is achieved. It has been a very long, tortuous, and sometimes frustrating journey. As of 2012, Nigeria was accounting for 50% of all, the wild polio cases in the world. Gradually, we have overcome reluctance to vaccination. As a matter of fact, even states in 2001, 2003, who totally rejected the polio, vaccines, to media campaigns against the vaccine, to shortage of funds, and challenges that we've had with insurgency. But when people are determined, to solve, a problem, there's always a solution to every problem. And I think that is what we have seen in Nigeria. The government, has, been on board and has been a major factor in the success. The GPI partners, which involves Rotary as a catalyst and contributor, WHO, CDC, UNICEF, the Bill and Gates Foundation, and in recent times, the Gavi Foundation, have continued to make sure that all the necessary human and material resources and technical resources are put, to use to ensure that we get to where we have gotten today. So it's a testimony to what, groups coming together to get to a common goal and achieve a vision. It's a testimony to what we can achieve.
All right.
And
now
going forward,
let's look at how we build on this success now. If you look at, there are concerns, if I may put it this way, with regards to the state of the primary health care centers, a major place where mothers take children to receive these vaccines. I wonder how much of a concern this is, if we are to sustain the fight, how much of a concern this is for you, and how we can nip this in the bud to build on the success we have achieved so far.
Yes, it is of a great concern to us that our primary healthcare system is still not where we expect it to be. We have had several opportunities to upgrade our healthcare systems so that every family will live within a short distance of functional healthcare centers. We've had a lot of declarations that Nigeria belonged to. I recall during the tenure of Professor Polio-free Kuti, he made it part of the cardinal purposes of his tenure in office to ensure that primary healthcare centers are revamped and equipped and staffed. We have gone up and down in this. Then we got to the 10,000 health centers era during the tenure of the past Minister of Health, Professor Adewale. That started, but again, that has been truncated. We need really to revamp our primary healthcare system. And people should not be looking at the central government for this. Primary healthcare, centers are the responsibility of local governments and state governments. And I think our state governments need to continuously be reminded and encouraged to provide a primary healthcare center in every local government at the minimum to ensure that, primary healthcare facilities are made available. And this is where immunization takes place. This is where our pregnant mothers, are taken care of to ensure that, we also reduce maternal, and child mortality.
All right, Dr. Tunji Funsho, we'll leave the conversation here now. Thank you so much for speaking with us.